Good morning, everybody, and welcome back to your Lunch Break Live. My name is Ivana. Happy Tuesday. We already got through Monday. That means we're kind of on a downward slope from here. Today, I am joined by UAB's own Dr. Stephen Russell. Dr. Russell is an associate professor of internal medicine and pediatrics. And today, we're going to talk about something that I know a lot of people are a little bit worried about and probably don't want to talk about right now, and that is the flu. We know flu season is upon us. That is kind of a bad part of the fall. We all love the fall. We love the football. We love the colors, the weather. But the flu, unfortunately, comes along with fall, and we've got to face it like it or not. So I know there's a lot of questions circling about flu in the time of coronavirus, in this weird working from home. Should I go in public? Should I quarantine time? So Dr. Russell's here today to talk about the flu, talk about the differences in the flu and COVID-19, and also what to do if you think you're sick. We're going to talk about the flu shot too, so stick around and hear more about the flu shot and why you should get it this year. Doctor, thank you so much for joining us to talk about this thing that nobody really wants to acknowledge yet.
Well, thanks, Ivana. It's nice to be here. Thank you for having me.
Well, it is, again, the flu season is upon us, and just because coronavirus is happening doesn't mean the flu stops. I know that we wish that was the case, but unfortunately, it is not. So have you seen or have you heard of flu cases already happening?
Yes, we know that there are some flu cases that have already been documented in Birmingham, documented both by the symptoms that people have as well as by the positive flu test. And we're just at the very beginning of the flu season. Like you were saying, when college football starts, we start thinking about those kinds of cookouts and tailgating, which of course have been limited this year. But we also start thinking about flu, which really gears up in October from a prevention standpoint. And then we start seeing a lot more cases come November and December.
Well, and we all know that last year there were so many talks about, oh, this is going to be a bad flu season. This is a bad flu season. Dr. Russell and I were talking before we came live, and I was victim to that flu season. It was not fun, I will tell you. And I did get my flu shot. So before y'all jump on me for that, I did. But Doctor, do we have any evidence or do we know about the upcoming flu season that we're in right now? Are we looking at a bad flu season, or is it too early to tell?
So every year, the Center for Disease Control tracks the flu, and they do it on a weekly basis. They can tell where flu is where there are hot spots in the community, state by state, and also what the trends are. So right now, here in the second week of October, we know that cases are about the same or a little bit less, actually, than they were this time last year. So while it's hard to predict what the actual flu season will look like, we have a lot of concerns what it will look like when you have two respiratory viruses, flu as well as coronavirus, that are circulating in the community at the same time. If there's a silver lining in that, I think one piece of good news is that there's been a very large push to start having people get vaccinated now. And I know we'll be talking about that, but if we can start to get more people protected here in October, we hope and expect that that will make a marked impact on the flu season we'll have.
And I know, let's jump into vaccines. I got my flu shot last night. I know everybody is saying, go ahead and get it out of the way. But doctor, there are people who, for one reason or another, choose each year not to get a flu shot. What are you and your medical professional colleagues telling people about getting their flu shot this year? And is it more important to get one this year than in years prior?
So let me start with your final question. Yes, it's more important to get the flu shot this year than in years past, and I'll go into that here in just a moment. But we have some folks in our office, and you and I were talking about this before we got started, who have had some hesitancy with getting the flu shot in years past. Some of those hesitancies come from the idea that people wonder, well, will I get the flu if I get the flu shot? And will the flu shot actually protect me? I've heard that it's not that good. So if we understand that the flu shot revs up your immune system, it gets you ready to fight off the flu when it sees it, that can help you interpret symptoms that you might have within the first day of having the flu shot. Some people have some muscle aches, some people even have a low-grade fever, but that goes away within 24 and certainly 48 hours. And when that happens, you can feel comfortable that your immune system is doing what it's supposed to do by getting the flu shot. The second part to this is that we know that this year, with people wearing masks that are required, with people having social distancing, and of course washing their hands, we know that that's going to reduce the ability to transmit coronavirus, and we fully expect that that'll reduce people's ability to transmit flu as well. One question that comes up is, well, do I even need the flu shot? I'm not a high-risk person. Well, we know that each year, and the Center for Disease Control actually looked at our flu seasons. Remember, I told you they're tracking this from year to year. And they looked at our flu seasons from 2010 to 2016. And based on that hard data that they could actually track, they know that people getting the flu shot reduced the number of deaths in the United States by 10,000. They reduced the number of hospitalizations in the United States each year during those periods of time by just receiving the flu shot by about 90,000. And they reduced millions of visits, some estimates up to 6 million, of people with flu-like symptoms going to their doctor. So it has an impact each year, and we expect that it's going to have an even bigger impact this year because of the two respiratory viruses that are circulating in the community.
That double whammy, unfortunately.
Right.
Now,
Right.
before I have so many other questions for you, but first I want to take a few from our viewers. I know my friend Dana is in here saying he got his 6 weeks ago. So you were ahead of me, Dana. I got mine last night. He said he had a sore arm. I do too, Dana. But look, if that's the price I got to pay, I'm fine with it. I still worked out this morning, pushed through it.
And that's fantastic, getting it 6 weeks ago, because that's the beginning of September. It's right around Labor Day, which Labor Day kicks off our push for flu shots. We expect that the flu shots are going to be effective at least 6 months, which takes you through March, of course. And the high point of the flu season is generally in January and February. So that's really important for those who've already gotten it. For those who are not yet getting it and looking at this Facebook Live or other information to maybe help inform their decision, we know that if you get the flu shot today, here on the 13th of October, it should be in your system, offering protection through the end of spring break, so at the beginning of April. And we fully expect that within 2 weeks of receiving the flu shot, your body's immune system is up and ready to recognize and fight off the flu when it sees it.
That's a very interesting point. I never thought about that, about how long that vaccine is good for. Now, we have quite some information here from Greg. And Greg, I'm going to call you out here and ask the doctor what he thinks. Now, Greg said he's battled Hep C for over 27 years, never had a flu shot. And he is saying, look, I'm wearing a mask and I'm going out. What do you tell people like Greg who say, look, I have never gotten one and I've always recovered when I felt flu-like symptoms. I'm fine and I'm wearing a mask now when I go out. What do you tell those kind of people? And do you suggest, like Greg said, I've had symptoms before, but I've always recovered. What do you tell those people about if they need to get a vaccine?
Yeah, that's a great point. And so for Greg's specific question, one of the things we know is that his body is already adept at fighting off certain viruses because it's been battling the hepatitis C virus. However, that doesn't translate into the ability to fight off the flu virus. And so we know that for people whose immune system is already activated, or for people who may be immune compromised based on underlying conditions or on medicines that they're taking, the flu shot's particularly important because it trains your immune system in a way that's different from that which you're already being treated for that which you're already fighting off. I would love to be able to say that the past, we can rely on that to predict the future. But when it comes to people who said, I've never had the flu shot and I've never gotten the flu, I don't know if we can rely on that this year for two reasons. The first reason is that we know that the flu doesn't really discriminate whether you've had it or not. And you can certainly get the flu shot certainly get the flu infection after having years of never had the flu infection before. The second part of that is we don't know as a medical and scientific community what the world looks like when you have both the respiratory virus of coronavirus as well as the respiratory virus of flu circulating at the same time. To Greg's point, we may not know if you have coronavirus or flu until we get our test back. And as we know, many places don't have the rapid coronavirus test. And to the further point from there, we don't have a good outpatient plan to be able to treat people who do have COVID-19. So it's particularly important to go into this season having the confidence and protection to know I've received my flu shot, my body's ready to fight this off if it sees it. And that way, if you do have those symptoms of muscle aches, of fever, of cough, you might interpret those a little bit differently knowing that you've had the flu shot.
Well, and we're going to talk more about that in just a second. Quickly, I want to ask you, this is from Rhonda, and Rhonda says, if you took the flu shot in August, can you take another in January or February for extended protection?
Oh, Rhonda, that's a great question, because you heard me say just a minute ago that we expect 6 months of protection. 6 months from August, of course, drops you off around Valentine's Day. So here we are in the middle of February, and you wonder, do I have all of the protection that I need to get through the rest of the flu season? And so at this point in time, we do not recommend a boosted dose, meaning if you had it in August that you need to go back and get a second dose. However, we do recommend that if Valentine's Day comes, or now we're at spring break a month later, and you start to have some of those symptoms of muscle aches, of cough, of fever, you really do need to be looked at and really need to be evaluated to see, is this flu with waning protection, or is this COVID-19?
Great advice there. And Greg saying he feels fine. He's staying isolated. Well, Greg, we are hoping that you continue to feel fine and just stay well for us, Greg. Okay. Now, doctor, let's shift and let's talk about these symptoms, because we've got people, like you mentioned earlier, that maybe had a flu shot and maybe start feeling a little bit yucky in the January, February region. I know that, speaking from experience, when I got my flu shot last year, and then in early January of this year, did not feel great. What do you suggest people do? What are the symptoms that we need to know? Oh, maybe I should go get a COVID test, or I think this is the flu. What is the kind of differentiating point?
So if we look at this from a clinical standpoint, what symptoms are going to make us worried? We're very familiar that people who have cough, who have muscle aches, just like you would have after you've been exercising perhaps more than you normally do, muscle aches throughout your body, and a fever, those three symptoms get us worried about the flu. But for those who've been following along, we know over the last 6 months that when there's not been a lot of flu in the community during the summertime, those symptoms make us particularly worried about coronavirus. And so right now, most doctors' offices and most hospitals are not taking a chance to use the clinical symptoms to test. Many places, UAB included, if they're testing you for coronavirus, they're also going to be testing you for the flu, because that test can help us differentiate one from another. And of course, as we know, that can help us give a reasonable treatment plan based on the information that we find out. But if you're just wondering at home, okay, I've never had the flu and I'm wondering if my symptoms may be related, the fever, the cough, and the muscle aches are much more specific to any kind of a respiratory virus, so it doesn't differentiate between the flu and coronavirus. However, traditionally, flu does not cause you to lose your sense of taste. Traditionally, the flu does not cause you to lose your sense of smell. And we found that to be a very specific symptom of people with COVID-19. It could be due to allergies. It could be due to runny nose for other reason. But if you're experiencing the fever, cough, and muscle aches, as well as perhaps shortness of breath, and you notice that your food doesn't taste like it used to, or you can't smell coffee in the morning, likelihood is you need to also be tested for COVID-19.
Now, there are say you have these symptoms and you need to go to the doctor to get that test. There is the worry that maybe I go in to get either a flu or maybe a double test for flu and coronavirus. What if I am going to be spreading that coronavirus to other people in the waiting room, even if I have my mask on and even if they have on theirs? Maybe I just don't feel comfortable going into that public setting. Is this a time where you need to call your doctor ahead of time and say, hey, I don't know what's going on, but I just want you to know? Or what do you suggest?
Definitely. We are there from a medical community to help troubleshoot those types of concerns. So for those who are listening, if you have a primary care provider or another type of a doctor, that would be your first step, is to go ahead and call her and let her know that you're having specific symptoms and you're worried that you might have the flu. I can tell you one thing that UAB is doing, and perhaps other communities or other practices in the community are doing similar, is a lot of the COVID testing is taking place outdoors. UAB, for those who are getting a procedure or may have a need for testing another other reason, they actually have an outdoor pavilion where that can be taken care of, either in a parking lot or another setting. Many of the primary care offices within the UAB system actually have a tent that's set up. And the benefits of that, both the outdoor setting, perhaps in a parking lot, or the tent that's set up, is that you're in the outdoor space, which we know can decrease the likelihood of transmitting COVID-19 and probably the flu as well. But you're also able to be tested in your car. And in those kinds of settings, when you call your doctor, she'll let you know that this is the type of symptom that you're having. And here's how in our system we can effectively get you tested. There may be some who are listening who don't have a primary care provider or don't have a hospital-based system, and they may be working through an urgent care or another system like that. We do recommend, if you know that you're going to go to a certain urgent care, call them in advance. Let them know what your worries are so that they can most specifically give you the directions on how to be tested.
So call before you go is kind of the key here. Now we've got a question from Lily, and this is a good one. She says, "Is there a different type of flu shot for senior citizens?"
Oh, Lily, that's a great question, and I'm glad you asked. The answer is yes. Let me give you a little bit of information about that. So the traditional flu shot has 4 separate components. We know that there's flu A and flu B that circulates in the community, and the traditional flu shot protects against all 4 of those: H1N1, the type of flu that's called H3N2, and then the 2 types of B flu virus. It's all in one vaccine, and when you get a vaccine that you may be hearing is called a quadrivalent or 4-type vaccine, you're going to be getting that. But for those who are age 65 years or older, there's a high-dose flu vaccine, and there's actually 4 times the amount of protection that one can get from receiving that high-dose flu vaccine. Now, let's say you're in a situation where you may not be getting out very often and you only have one opportunity to get the vaccine. If that provider or if that clinic or pharmacy doesn't have the high-dose vaccine, well, go ahead and get the regular. You'll still receive the protection. But for those who do have the option for the high-dose flu vaccine, for those who are 65 and older, go ahead and take that. There has been some good evidence to tell us that it will protect you, and it will have long-term benefits during the flu season of side effects you might get if you were to develop the flu.
Is that that vaccine that senior citizens or people over 65 that are not considered at the point of senior citizens? Now, is that something that all pharmacies typically have, or is that something that you need to call your specific pharmacy or grocery store for before you go?
Right. Most pharmacies that I'm familiar with, at least the large grocery store and big box pharmacies, are going to have that. And so if you go in there and let them know, they will likely be able to provide that for you. Most doctors' offices, I know within the UAB system, part of the primary care system network that I'm a part of, also have that available and are offering that to those who are over age 65.
We've got a comment here from Billy, and I think a lot of people have the same impression. And he says that COVID's going to be worse because of flu. Now, if I didn't read that correctly, Billy, I'm sorry, but I think that's something that a lot of people are saying. Look, COVID and flu together is not a good thing. And I know that this is not something that we have seen before. Thankfully, we haven't seen it before, but also it's a little bit scary. But do medical professionals believe that that is true?
So, Billy, it's a good question that you're asking. And so let me address that in 2 separate ways. The first is for you personally. So if you were to get COVID-19 and then shortly after that get influenza A or B, your immune system is going to be fighting off 2 respiratory viruses. Both of those viruses have complications. We know, as I mentioned previously, that there are thousands, actually tens of thousands of deaths that can occur each flu season, each year, as a result of having influenza. We are well aware of the over 210,000 deaths that have occurred just since March in the United States. Double that for make a whole year. And of course, we get quite worried about the lethal effects of COVID-19. If both of those were to occur in the same person, we can speculate on what might happen to that person, and our speculations are concerning. We only have one medicine or one group of medicines that we can use for those 2 respiratory viruses, and those are medicines used against influenza. But let me step back just a moment and take a little bit of a larger view. Many people may have heard that the intensive care units within the Birmingham area were quite full, specifically in the middle of August when COVID-19 was at a peak. We also saw a similar peak around late March and early April. Those beds are a limited number. We only have a limited number of intensive care unit beds that can be offered, with all of the services that can be offered for those, including supplemental oxygen if it's needed, including using ventilators and all the respiratory support if that's needed. We know that each year people with influenza end up in the ICU receiving those types of services. And so our big concern right now is from a systems issue. We're worried that we may overwhelm the system with both COVID-19, which of course is still in the community in the ICUs, as well as influenza, which will be in the community and will be sending people to the ICUs. So what can we do, Billy? We can get our flu shot. We know that will give you protection. And even if you're one of the unfortunate few who ends up getting influenza after having the flu shot, not because of it, but after having the flu shot, we know that your body is at least trained to fight that off. And we know that your infection will be less severe than it would be had you not received the flu shot. And so as a result, you hopefully won't be stressing yourself or that system by needing an ICU bed.
I'm going to let you play Mythbusters here for a second because he said that he has seen studies that say the flu vaccine increases the risk of other respiratory viruses. Is that true or false?
So the question that comes up is, if you're getting a vaccine, is that going to lower your immune system for fighting off other things? It's actually the presence of the two viruses that make things more difficult than the presence of getting the vaccine itself. I'll give you an example. So I'm a board certified pediatrician as well as a board certified internist. And so part of my job is providing vaccines for children. And we would not want to withhold those vaccines in any way, knowing that we can protect them. It's very standard for a child at 2 months, 4 months, and 6 months of age to receive 4 separate vaccinations at a time, which actually comprise protection against more than just 4 separate infectious diseases. And so we're not worried that receiving more than one vaccination to fight off an infectious disease will increase your risk for getting another infectious disease.
I'm going to, again, continue my Mythbusters spinoff here. And we've got one person, and I think I'm going to know your answer, but we've got one person saying that if people would just turn off their TVs, then stuff like this would all go away. Is that true or false?
So it will go away for the person who turns off their TV. However, when she steps outside her door or when he goes to the grocery store, those things which they may have been shielded from because they're not listening or looking at will still be there. We have heard many stories of people who go to a wedding or unfortunately a funeral, people who have a family gathering. Our family loves to get together one Sunday a month to celebrate birthdays, but we're not doing that now because we know that in those settings, you can pass the virus, and this is true for both influenza as well as COVID-19, before you even know that you're sick. And so, of course, most people are well trained now to say, I have muscle aches, I have a fever, I have a cough, I'm not going to go outside. And that's good advice, and we certainly recommend that. The worry is those people who are spreading the virus before they know that they're sick. And when you get together in communities of your family, in communities at the grocery store, or in communities at your faith-based organization like your church, we know that you're more likely to receive or to spread that virus if you're one who could do so. So I think being informed is helpful. There may be certain media platforms that people feel like they can't necessarily sift through all the information that's there. So let me give you some knowledgeable resources. We have a very good confidence that the Center for Disease Control is staffed by career scientists who are experts at what they do and want to make sure that you and I are protected for the things they can protect you from. So if you go to cdc.gov, you'll find that information, which is driven by the scientists, and it's not something that changes from administration to administration. So that's important, and that's a worthwhile resource. We also know that the Alabama Department of Public Health has a fantastic website, which also will give specific information. And so those are good scientifically based resources people can use on the internet. And call your doctor. She'll have information for you that will be very helpful if you simply ask.
Great note to end on, Doctor. Trust your trusted sources. Get your flu shot. Don't go to work or go anywhere if you feel sick. Those are very important things that we need to note. And again, if you think that you're coming down with the flu, but you're not sure it could be COVID, make sure you call your doctor, urgent care, or whatever facility before you go and get tested. Doctor, thank you so much for all of your helpful information here. We had Lily drop back in and say that she has gotten her provider to order that flu shot, that senior citizen 65 and older shot for her. So Lily, good luck with that. Glad you're getting it. Everybody else who in our comments has said they already gotten it, good for you. Again, I got mine last night, was
Absolutely.
quick and easy. So Doctor, thank you so much for your time again. And for
Ivana,
everybody,
thanks for having me.
Yes, sir. For everybody watching, thank you so much. You all stay safe and healthy, and we will see you tomorrow.